Hello everyone, welcome to Talking Here with Dr. Laz, your favorite health program on television, reaching you from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. Yes, today we will continue conversation which we started some weeks back on primary health care. Primary health care is that health services that is closest to the people wherever you are, anywhere in Nigeria. It's not rural health care like many tend to think or believe. And since 1978 at the Abia.Adamawa Declaration at the International Conference on Primary Health Care, different countries have been making progress, and Nigeria is not left behind in that regard. But are we really very happy with the state of primary health care in Nigeria? You know the answer, but what we'll be talking about is how do we fix all these problems. We can talk about so many of them from today till tomorrow, and why we keep bringing this up is because we are in pre-election year, and this is a period to begin to set agenda for people who will be coming into elective and appointive office, especially from 2023. Any community that's yet to write down their health needs or their primary health needs should begin to do so now, because as campaign begins from September, October, as the case may be, you need to be presenting this, you need to be making these demands at this point and begin to extract commitment. Yes, you may recall some weeks ago we showcased the national ranking, primary health care service delivery ranking, done by One Campaign, World Bank, National Advocates for Health, as well as other partners working with relevant government agencies. And in that ranking, they showed the 36 states and the FCT using about 20 indicators, and we are going to be looking at further details. I have a healthcare professional, a professor, a health systems economist who will be joining me to have a look at this. And I know you can't wait to watch as we discuss this and making relevant recommendations as it has to do with primary healthcare in Nigeria. But before we get deeper into that conversation, I'm going to highlight some of the findings of the multiple indicators cluster survey, as well as the National Immunization Coverage Survey, which was just released within the last couple of weeks, so that you see how nationally we've performed, as well as how some states are performing in these very important primary healthcare indicators. Do stay with us, we'll be right back. Welcome back to Talking Here with Dr. Laz, your favorite health program on television. Yes, we'll be talking about how we can fix primary health care in Nigeria and what we need to do going forward from this year to next year till forever to make sure that our primary health care is working efficiently, effectively for everyone, everywhere in the country. So, and with me to discuss this is a professor, a public health physician, and also the health systems economist, Professor Chima Onoka. You're welcome to the program.
Thank you very much.
He's a professor at the University of Nigeria in Soka.
Thank you.
Yes, before we get into those primary healthcare rankings, the multiple indicators cluster survey and the National Immunization Coverage Survey results were published, I think last week, released to the public last week, conducted by National Bureau of Statistics with UNICEF, Federal Ministry of Health, National Primary Healthcare Development Agency. And there is some improvements in immunization data. It shows that the number of children aged 12 to 23 months who have not received any vaccine at all is now 18%. That's like 2 out of 10, compared to 2016 when it was like 4 out of 10. Then another data of interest that relates to primary healthcare is also open defecation. Although there is some increase in terms of those who report to be having open defecation, is still 1 out of 5. You know, moved from 20 to 22%. 22% increase in that. There is also other data on birth registration, as well as female genital mutilation, but we'll not be going into those details. So generally on this immunization and also that of open defecation, what do you have to say?
Well, I think it's, very good to, know that, there was that improvement in immunization coverage. Obviously, those that are missed, that is reducing. And I think it's very positive. There has been this consistent improvement, and that's the kind of thing that you want, a consistency, not a one-off thing. I think it's very positive. It's how to sustain this. I mean, it speaks to a lot of work that we know has been happening very passionately by the primary health care agency that is involved in this, and of course at the state level. Quite a lot of intensive work over the last few years, and the results are not, you can't deny that there's a lot of effort. However, of course, there's still a lot that needs to be done. We need to get to the point that no child is missed.
Particularly for Sokoto State, that has the worst indices, 51% of children, like half of the children in Sokoto State have reported not to have received any immunization at all. So that's not speaking good.
Sokoto has been a bottleneck. And it looks like there is quite a lot of investment that has happened in Sokoto in this direction. There's still a lot more to be done. Maybe it's one of those states that one of the things that should happen is not just about immunization, looking at it in a narrow-minded way, but the broader things that are making this to remain like this, where Sokoto. So those additional things need to be fixed, and so that Sokoto can. But that's a good case study. That all those things need to be discovered, and so that the bottlenecks can be dealt with.
Exactly. I congratulate Ebonyi State that reported 0. Of course, that's my state.
Yes.
So we have 100%. Every child in Ebonyi is being immunized, at least received some vaccine. Enugu State had 1% of those that are reported not to have received immunization. So I really like everyone. That data is being projected on the screen. You check out where your state is, and as they are campaigning, you begin to ask the right questions. What will you do to make sure that every child gets vaccines? So now going to this primary healthcare ranking, let's get to the screen and have this conversation. Yes, so this is the report that was launched some weeks ago, the state of primary healthcare service delivery in Nigeria. And it ranked all the states as well as the Federal Capital Territory. So let's move to the next. Yeah, so at the beginning part of this report, it wrote this. For this report, the gold standard is that less than 5% of eligible health facilities are reporting stock outs of health products for TB control. Maybe you speak to why they use TB control specifically. 80% of eligible health facilities providing reports in the reviewed quarter, as well as a lot of things that have to do with stock levels of health, So, and the state has strong supply chain governance through its logistics technical working groups. A lot of English there, but it's essentially speaking to having supply chain, having drugs, having commodities that is being used for. But what do you think they use TB as a reference for this report?
I think there are so many commodities that people can pick and use, but in this case, I think it's important to focus on, commodities that reach not just the rich and wealthy, but also the poor. We know that things like TB, there's quite a lot of concentration amongst groups that are not as well-to-do as others, and also very vulnerable groups. So when you're having, and it's easy to just overlook such commodities and the services that are provided. And I mean, people will be talking about cardiac surgeries, cardiovascular, non-communicable. But when you're getting to issues like TB control,
at primary healthcare level.
At primary healthcare level, then you're really thinking about access, whether people really have access.
All right, so let's get to the next, the objectives for the ranking to assess outcomes achieved by state governments by October 2019 against global and local benchmarks. Okay, so they're looking at as at October 2019.
Correct.
Okay, so not what's happening in 2022.
Well, it's actually to have some, when they are thinking about 2021, I suppose that's why they did it. Look at the things that were happening in 2019 so that we can speak a bit to figures that, or whatever changes are happening by 2021.
Right. So they also assess the human and material as well as financial resources provided by states. I like the fact that there is focus at the state level, because most times on finances we tend to talk Abuja declaration at the national level.
Yes.
Okay. Comparative analysis of efforts of state governments by December 2021. Okay, so as well as proposed system-specific interventions. So those are like recommendations. So let's look at the ranking itself, how the states ranked. So I can see FCT at the top.
I mean, FCT is owned by the federal government.
Yeah.
So which is a bit different from the states, really.
Okay, so 68 points. At the bottom, I see Zamfara with 38 points.
Yes.
Sokoto, not just second to the last, Taraba and all of that. So this is important. Of course, it doesn't mean that the states, or does it suggest that the states on green are good to go?
No way. I mean, no state can sleep. Nobody can sleep. We're not where we should be. I mean, that's
at least none of them have scored 100%.
Yes, and then 68, I think, is still far from 100.
Okay, FCT, Enugu, Anambra, and all of that.
But
so,
the core thing, you see, maybe to start it from there, is a focus on states.
Right.
There's often a distraction. Averages are always a problem when we focus on the national. I think that Nigeria can get it right, except we focus on states.
Right.
That is where the real action happens. And if there are figures, health outcomes by 2019. This report is actually showing not the outcomes by 2021, but basically what people are doing to make sure that the next time you're assessing health outcome, that it should be different from what was there in 2018, 2019.
Exactly.
Yeah, but the focus on states is a thumbs up for that.
Right. So I think let's get to the indicators that were used. This was extracted from the study itself. We may not run it 1, 2, 3, 4. I think there are like 20 indicators.
Yes.
So what can you speak to these indicators? There are some experts who argued the fact that, okay, why should we say primary healthcare service delivery? That these indicators were speaking more to systems, governance-related issues, policy-related issues, and not a lot of indicators that has to do with day-to-day things that relates to patient care. What do you say to that?
Well, I think there are so many indicators, hundreds of indicators we can use. But this, it's not, I mean, they say if you want to, the enemy of good, of the perfect is actually, you can end up not doing anything. But this is a step in the right direction. It's not complete. I don't think it's complete. But then it speaks to a few things and adds layers to what we've had previously. But then it has very important things. And even though it talks about primary health care, it is a systems thing. Right. The reality is that if systems are not fixed, you can't do much. We are moving, or we should move from that place, that position of focusing on programs.
Okay.
The emphasis on programs is a distraction. It helps in the short run, but Nigeria has shown that except you build the systems, you just be oscillating. You just jump up today and come down tomorrow.
Moving in a zigzag direction.
So the focus on systems is good.
Okay.
I would support it, 100%. And the indicators actually have spoken a bit to some of the policy issues and things, starting the implementation of something like the Basic Healthcare Provision Fund is speaking about both political will issues, but also financing issues. Because before you start, you should be willing as a state to start, contributing to that bucket. And then what are states doing in terms of their own budgetary commitments as well, which is critical. And even beyond financing things, the human resources for health is actually, there are some basic things, whether you have the availability of some of those HR.
And by human resources for you are talking about staff.
Yes.
Who are working in the health facilities.
And the truth is that it's probably the most important. Health systems component. If it's not there, every other thing just hangs in the air.
And perhaps where we are doing most poorly.
Yes.
In many states are actually.
Incidentally, once you go through is HRH, and I think it's an emergency. It's an emergency for Nigeria, and it's something that these reports really highlights.
Yes. Okay. So many other indicators like vaccination and all of that.
So some service delivery things are captured as well. Antenatal care and then delivery, which should be, largely happening at the primary care level, primary health care level. And
I'm happy that they used the 2018 National Demographic and Health Survey as benchmark to do some of these analysis. Let's move to the next slide, but we'll be talking more about it after the break. You know that the Federal Capital Territory was ranked topmost in this report, but there's also another study conducted within the FCT that went deep dived into the situation of primary healthcare in the Federal Capital Territory. And we're going to be using that to see that if we have those gaps in FCT and they are coming tops, then that will let you know that we still have a whole lot of work to do as a nation in terms of primary healthcare. So we'll be back to this conversation after this break. Do stay with us. Welcome back to Talking Health Dr. Laz, your favorite health program on television. Yes, we're talking about fixing primary health care in Nigeria. And with me is Professor Chima Onoka, a professor at the University of Nigeria, public health physician and health systems economist. Thank you, sir. Back to this, FCT scored 68 at that national primary health care ranking. But this is a state of primary health care in Nigeria's Federal Capital Territory and accountability scorecard. I was involved in the development. I actually led this on behalf of a number of partners who supported it. So let's go to the next slide. Yes. Okay. The part that has to do with leadership and governance. This column started from Abaji, Amak, Buhari, Gwagwalada, Kuje, and Kwali. So
the last should be total for FCT, right?
Yes, the last is total. Okay. Yes, so I'm sure we'll project the first one that has all of that on the screen later. So we start from service delivery. In terms of governance, many of them had green on the indicators that were studied. So can you speak to this data, for FCT? And 62 health facilities were assessed, one per ward, so which is like the best in each of the 62 wards in FCT. So what does it tell you?
I think this is quite interesting because when you look at what came out from the consortium, the team led by One Campaign, it seems to, project the same kind of things that this report is showing. So really in terms of service delivery, the core things, the ward, having all those people in the ward, and if they offer services, I think, to a large extent, these haven't been too much of a problem in FCT over the years, especially in those focal PSC facilities. We see that they do something. The problem has been around quality. And then we're seeing quite some greens around those, whether they offer services. And, but then we're having across board, and that's something that is of, quite some concern. Things around having regular water supply.
Right, Abaji, 30%, just 3 out of the 10 focal PSCs in Abaji say they have regular water supply. And none of them has regular power supply, 0 in Abaji.
Yes.
Amak,
and you can
36.
see for water. So water is like the main central area. So that's Amak 91%, and Buhari 80%.
And Buhari is Kubwa, Axis.
Those are the towns. And I mean, you would be expecting something like that.
Okay, 60% is Kuje. Then, right. So Gwagwalada 50%. So Abaji and Kwali report 0 in terms of power supply.
And that's
none, and you have 10 wards in each of these area councils.
That's quite disturbing, really. And I'm a bit surprised about. No, that's Kwali, actually. So that's
Kwali
is
0%.
And
0.
That's one direction. I mean, after Gwagwalada, it's Kwali and Abaji that you're meeting, and it seems to suggest that the further you go from the city center, the less likely that you're going to have light. And I think I've done some things in Kwali, and I think I will agree with this report. You're basically on your own most of the time. Right.
So now looking at human resource for health, that's also, and one of the things that came out strongly is many of these health facilities say they had volunteers or ad hoc staff that those who are employed had to bring in, make some money and pay them from it and all of that.
You're going to meet a lot of that in FCT. A lot of, I think I've seen quite some of that in the facilities that I've visited before now. Volunteers who are there. But it's not that it's out of place to have volunteers, but it's a mechanism for maintaining them and seeing that they are well motivated to provide services. Right. And I mean, there's a lot of shortage in terms of manpower that we have now, especially for quite some critical health workers. So that's something to really look into, and maybe brings in the issues of even the tax shifting and all of those skill translation things that need to happen because they just have to happen. But it's a problem. Definitely. And if it's a problem in the FCT. Then you can imagine.
I would not want to talk about human resource issues in Ebonyi State. I would not want to talk about that. Let's celebrate the immunization 0 that,
correct.
We score. Okay, let's move to the next slide. Right, so this is essentially that still on human resource, mostly REDs, medical products. So these were checked within the 6 building blocks of the health system, looking at these indicators. But PACs that practice the pool supply chain system is where you have most REDs under supply chain management. And
you can see the issues of logistics as well as data managers. You see, where we're having REDs here, the health records officers, accounts officers, if you don't have them, it's a bit difficult to assess whether people are actually making progress. These are the people that should capture data. We have people who are going to manage basic healthcare provision funds. You need accountants to keep all the records. So these issues are systems issues that will affect the outcomes that we are looking at in a very deterministic way, and they really raise red flags, really.
Okay, so let's move to the next slide. Yes, this is just a summary of all we've discussed, as it has to do with different area councils. I really want to thank This was led by Association for Reproductive and Family Health and FCT Accountability Mechanism.
Okay.
Of course, with support from USAID IHP. So let's move to the next. I took this picture in Afikpo, Ebonyi State. I was there a couple of weeks ago. This was the health center. This building was a colonial building, you could see, made with mud and all of that. And the first time I went there was March this year. This part had fallen, you know, the part you've seen. So 2 weeks ago, this other part had fallen. And the community had been building a town hall for over 40 years. So they are already prepared. They formed a health committee recently, prepared to move there. But of course, resources were not coming as they should. So what do you say about this?
Did they have a World Health Committee?
Yeah, they have
or is it the main town hall committee?
No, they have a World Health Committee. Every ward in the state does. Okay. But one thing we've observed, because Talk Health Nigeria has been doing campaigns for communities to have health committees and also checking out what's happening at the ward level. Many of them see it as political appointments. You know, perhaps the selection process and all of that. So we're not pushing for beyond the ward, villages, as required by the World Health System and the National Health Act, should have village health committees, which the Amangbala set up Amangbala Health Committee as a subset of that of the ward. So, and since they started that, there's been rapid, you know, in terms of attention towards health distance. But I don't know. This is probably not the worst you could see anywhere, but for people to be in this building and it fell, that had to force them to move. Let's move to the next picture. I don't know if we have a capture of the new location. I think we'll show a video of that on the screen. Why we're showing this is primary health care beyond the buildings. There are so many things involved, and communities needs to take more action, and as well as government.
And I think we're getting into a political season already.
Right.
And these are the things that people need to say clearly. I want to change the picture of this. I want to have another picture after the first year in office or 6 months.
Right.
These are the kind of pictures we need to throw out there.
I'm hoping that in the next few months, perhaps before the end of this year, I'll be able to show a picture of the same Amangbala Health Center in a very beautiful environment. They've moved to the town hall. There's a section, but it's not been fully. They say they need about 10 million naira to get that done. Ebonyi State's Primary Healthcare Development Agency and Ebonyi State government, if you are watching this, is a call to action, you know, not just for this health facility. There are so many others, but we won't have time to be going into that. So, Prof. Onoka, generally speaking, what should citizens and communities do to make sure that primary healthcare becomes a top agenda as we move into 2023 elections?
I would say, first of all, is ownership, to own it. Wherever you are in the world, I want you to realize that there's somebody that's knows you, or you have a relation somewhere. The least that you can do is to do whatever you can to provide them with health care.
Thank you very much, Professor Chima Onoka, for being on the program today.
My pleasure.
Thank you for watching. I hope you've learned one or two things. The key message is health is wealth, and without health, you have nothing. Do your part, and let's make our hospital work. My name is Dr. Laz Eze. I'll see you same station, same time next week. Bye for now.